Medica, decode the remedy, that is ADONIS ver or ADONIS vernalis. This remedy, according to Phatak Materia Medica, is the remedy of degeneration, not a excitement. It is a cardiac remedy, cardiac degenerative remedy. It prominently acts on heart muscle, circulation, and kidneys. Secondary action on the kidneys. Secondary effect on the kidneys, especially when heart suffers from rheumatism, influenza, nephritis. There is no, this is not an acute inflammatory remedy. This is the remedy for of failing compensation. So main causes of the adonis is causative factor is rheumatism, influenza, and nephritis that leads to cardiac problems. So essence and core of the adonis is weak heart trying to maintain the balance. The heart is weak, which is trying to maintain the balance. Contraction power of the heart is poor, rhythm is disturbed, compensation is struggling. This remedy regulates the pulse, improves the contraction, increases the urine output. So, Adonis vernalis supports the tired heart, not the excited heart. So, from in a mental picture of the Adonis is not marked. It is a organ remedy. Vertigo with palpitation, words on rising or turning the head, aggravation while lying down. So the patient may say to you that, doctor, when I lie down, my head spins and my heart start racing. So vertigo with palpitation, aggravation by lying down. This is not a fear of death like arsenic, or not fear of death like aconite, or anxiety like arsenic. Mind symptoms reflect the circulatory insufficiency, not the emotional pathology. So, physical generals day to day practice as worse from cold, worse from lying down, better from gentle motion, like a rustox. Unlike many heart remedies, slightest exertion improves. Thirstless remedy mainly, appetite and thirstless remedy is a strong keynote. Sleeplessness, rambling thoughts, horrible dreams, often due to the poor circulation and congestion of the heart. So particular symptoms and keynote of adonis is mainly most important action on the heart: weak heart, fatty degeneration of the heart, arrhythmias, rapid irregular pulse, precordial pain, dyspnea. So the pathological condition that covers by adonis is mitral regurgitation, cardiac stenosis, compensatory hypertrophy. Adonis supports the failing compensation, not in acute inflammation. In respiratory system, frequent desire to take deep breath, dyspnea, cardiac cough, which is dry, tickling, dyspnea, worse on the touching back, dropsy and effusion. It has cardiac dropsy, ascites, anasarca, hydrothorax, with increased after giving this remedy, the urine output is increases. It also have albuminuria, scanty urine, head and mouth symptoms, vertigo with palpitation, as I said, scalp feel tight, tongue sore, scalp feeling, neck and back stiff, spine stiff, aching, tired feeling, vesicles on skin. So, most important, on which pathological condition we can use adonis. So, first condition is dilated cardiomyopathy, post rheumatic heart diseases. So, dilated cardiomyopathy, I frequently use mother tincture 10 drop at night. Post rheumatic heart disease. So in nowadays, rheumatic heart disease is less common, but in old patients or who have rheumatic heart diseases, the remedy of choice for acute to maintain the patient is the ADONIS. In rheumatic valvular heart diseases, mitral regurgitation, aortic stenosis, any of the condition due to the rheumatic heart diseases, the pathological or organ remedy to support the heart is ADONIS. In mother tincture, 10 drops at night. Another condition with heart failure with preserved or reduced AF. Cardiorenal syndrome due to the cardiac insufficiency, renal failure or chronic renal failure may occur. Congestive cardiac failure, this is the remedy. In investigation or in 2D echo, we may find that low or borderline EF, arrhythmias on ECG, albuminuria on urine examination, uh, pleural effusion due to the cardiac insufficiency may find in X-ray. 2D echo may give us insufficient mitral wall, aortic wall. This is the degenerative and functional failure, not acute myocarditis. Due to the influenza or the streptococcal infection, heart get damaged, walls get damaged, and then due to the compensatory mechanism, all these symptoms occur. So we have to differentiate the cardiac remedies more 4 or 5. In day-to-day era, we need to support the system because patients are more in anxious state about their reports, and they are on medication like digoxin, Lasix, Ditor, Cardioron. These are the cardio supportory medicine. And after patient comes to the us, we need to give him quick relief and support the heart, strengthen the heart. So there are 5 to 6 cardiac remedies that we need to differentiate, and we need to use these remedies in day-to-day practice so that the patient feels more better in a day or 2 days, and after that we need to have constitutional and anti-miasmatic remedy. So understanding the relationship as given by Dr. Phatak, ADONIS is the extremely important remedy because these remedies rarely stand alone. Uh, it requires constitutional medicine to complete the cure or improvement occur. It often supportive, intercurrent, phase-specific cardiac remedy. So ADONIS does not replace the constitutional; it protects the heart. So in our Materia Medica, ADONIS belongs to the group of cardiotonic remedies. It has specific role. It is not a culminative remedy. It regulates the rhythm, it improves the contraction of the heart, it increases the cardiac urinary output. So this remedy has 3 important features: regulates the rhythm, improves the contraction, increases the urinary output. It is not a culminative remedy. It makes when the heart is weak but still responsive. Heart is weak but responsive. Compensation is failing but not collapse.
Who do you want to text?
Think of ADONIS as a bridge remedy. So we need ADONIS and digit compare.
There are 25 contacts like that. Here's the first 3.
ADONIS
Drive Vikas Katak. Drive Prasad Joshi.
So ADONIS need compared with digitalis. So these both remedies have the relation that comparative or sequential remedies. May we need digitalis and after that ADONIS. So both have weak acts on weak heart, dropsy, arrhythmia, but their depth and danger are different. So in digitalis we have slow pulse, extreme weakness, cyanosis, fearful collapse, and culminative action. Digitalis is slow pulse, extreme weakness, cyanosis, fearful collapse, and culminative action. While ADONIS is irregular pulse, fatty degeneration, better by little exertion. It is not culminative remedy. So uh, when digitalis is too strong or risky, ADONIS is safer. Digitalis wipes the heart, Adonis trains the heart. So these are the some differencing point. In Adonis and Crataegus, both have supportive and nourishment remedies. Both have complementary reaction to the each other. So the Crataegus has nourishes the heart muscle, while Crataegus has structural support, long-term cardiac tonic. You may give Crataegus for a long duration of time, and and Adonis is regulates the rhythm, improves the contraction, and controls the drop T. Both in acute phase or in acute phase, you can give Adonis then followed by Crataegus. So acute decompensation, you need Adonis. Long-term support, you need Crataegus. Crataegus has marked sleeplessness in concomitant symptoms and palpitation. Crataegus feeds the heart, Adonis steadies the heart. So both remedies go side by side and both have complementary action on each other. Another remedy is Adonis and Colnovaria. So we need to differentiate these remedies, and both remedies have different action, but we need to differentiate these remedies. So Colnovaria has venous congestion, right-sided heart failure, jugular fullness, dyspnea from venous load. While Adonis is myocardial weakness, arrhythmias, fatty degeneration, and cardiorenal involvement. So venous congestion dominates, we need to go towards the Colnovaria. While muscle weakness and rhythm problem, we need to go towards the Adonis. Another remedy which be very close to the Adonis is Stropanthus. So Stropanthus has sudden cardiac weakness, acute heart failure, it acts quickly. While Adonis is subacute due to the chronic failure, regulation rather than stimulation have Adonis. Stropanthus have history of or concomitant patient may have alcoholic or desire for alcohol. Stropanthus is a remedy for emergency support. Adonis is ongoing to the balance or after that word remedies. Another remedy that we need to differentiate is Adonis versus Bufo. Both are related remedies by Dr. Phatak. Bufo and Adonis has cardiac involvement, nervous system overlap, but Bufo more towards the neurological, developmental epileptiform remedy in backward children or in Down syndrome, while Adonis is purely cardiorenal axis action. Use Bufo when heart symptoms coexist with neurological signs. So, in chronic case management, how we use the Adonis? So, in between constitutional doses, during cardiac decomposition compensation, with when there is renal output is low, when there is edema dominates, it helps to stabilize the patient, improves the urinary output, and prevents the disorientation. So Adonis buys time for constitutional to act. So some when not to use or mistakes while using Adonis. Use as a constitutional remedy in acute myocarditis, confused it when digitalis, in extreme collapse, we didn't use Adonis in extreme collapse. Adonis regulates, it does not revive the dead heart, while digitalis revives the dead heart. Uh, so, in summary, how these all remedies, digitalis is too strong, give Adonis. Heart needs nourishment, give Crataegus. Venous condition dominates, give Colnovaria. Emergency collapse, we have to Stropanthus. Neurocardiac overlap, Buforana. So Adonis is the calm-handed that steadies the tired heart. So, prescribing totality or totality of the symptoms, that we need to think of for Adonis is history of rheumatism, influenza, and nephritis. Weak, irregular heart, dyspnea with dropsy, arrhythmia, albuminuria, worse on lying, better by gentle exertion, and no thirst. When compensation is failing but vitality remains, Adonis will help you. Adonis is supportive, regulating, and non-cumulative, ideal for chronic cardiac management. Potency, mostly mother tincture in all potencies, and in some cases 6 potency. Mother tincture 10 drop night or 10 drop 2 times a day depending upon patient's vitality stage and sensitivity. So, in 3 or 2 words, how the core of the or how to remember the Adonis vernalis is weak heart, arrhythmia, and dropsy. So, Adonis touches us not every week needs to be stimulation, some needs to be regulation. It is the regulated remedy. So, this is all about how Phatak described Adonis vernicularis. Thank you for patiently listening, and in next session we can see another remedy. Thank you.